Hello, friends. Deepa here. I'm trying to answer the question set by Miss Angelina Wagner. What are some other ways to set boundaries in the counselor client relationship? I was thinking about this answer and how to answer this question, and I came across two really interesting articles. One is Necessary Boundaries for Healthy Counseling Relationship, and it is from the Vantage Point Recovery. So they have given some very interesting points. They start with explanation what a therapeutic relationship is. And according to the article, a therapeutic relationship is a close relationship with at least two people in which one person, the therapist, is helping an individual, the client, change his or her life for the better. And there's different phases of therapeutic relationship which are explained here, which include the orientation phase, identification phase, working phase, and the resolution phase. And through each of these phases and every therapeutic phase, it is necessary to have a very clearly communicated boundaries between the therapist and the client. And these boundaries are good decision-making skills. It depends on the counselor to set the boundaries, make the boundaries clear, so every attempt not to cross the boundaries are made. And these are also steps to make ethical decision making. And some of the steps that to make ethical decision making include state the question or concern clearly. So whenever a question is asked, do not make it confused, make it very clear. Anticipate who will be affected. So whenever taking an action, always remember or think about what the effect would be or the reaction would be. Determine who the client is. Act as if you are the right person to do the job. Analyze oneself. Self-awareness is one important thing the author emphasizes in here. Assess if you are the right person to do the job. Review ethical standards, review legal standards, review research and history that are relevant of the situation, and always have a plan B to decisions. Go through the document process in a very elaborate way. So these are the ways they suggest to maintain a healthy relationship and not to be careful not to cross the boundaries. The author also goes to explain that the healthy boundary allows a person to have high self-esteem, be assertive, and make good decisions. Healthy boundaries also leave a person feeling good after the session. So it's always better for the client and the counselor to maintain a healthy relationship. And some of the benefits of healthy relationship are, and it's how the importance of doing what is best for the client and benefits the client most. It is an action that's done to benefit the client. They keep emphasizing that again and again. And make sure no harm to the client has been done. Autonomy in when the therapist promotes the client being independent, and the autonomy helps client making their own decisions. So there are many other steps like explaining what unhealthy unhealthy boundaries could result into. How would you be viewed by the colleagues, family members of the client, your family, and friends? Is the client being given special treatment than other clients are not receiving? Are you comfortable writing about this in the progress notes of the client? Does the action benefits the counselor or the client? So before taking any action, or think about it and analyze these questions just to be a self-evaluate or self-examine that what the counselor doing is right, or is he or she crossing the boundaries. And the article also clearly explains, when in doubt, do not do it. So if any action you feel that it is unethical, they are asking us to avoid it. So always get feedback from supervisors in the field, check the legal remnants of behavior, and so that is what they always suggest. I also read another article which says Drawing Boundaries by Deborah A. Loth and is written in 2016. Forget sex, it's the smaller intimacies, sometimes even commonplace courtesies, that the present biggest dilemmas between clients and therapists. That article also I found very interesting, and it says one of the issues within the therapy is a tendency in close relationship to lose oneself in the other person. Again, being too empathetic and with um carrying on the emotional status to a different level is what makes the boundary crossing happen. Good boundaries, however, are not equivalent to good therapy. Boundaries exist to protect the therapy. They're not the therapy itself. It is quite possible for the therapist to keep the boundary and lose the patient by enforcing boundaries in a restrictive, legislative, and a defensive manner. So it has to be in a very balanced manner, and especially when it comes to the self disclosure part. There's a portion there'll be sessions where you expect the client to open up, and the client asks back questions to the counselor, and then the client has every right to know what they ask about a healthy professional, whether the therapist received education, what kind of license she holds, or what kind of expertise she has. But beyond that, there's no point to go with the personal aspects. It's always better to draw the boundary and make it clear where the boundary lies. So again, good therapist neither withhold or disclose information about themselves and lose the sight of the fact that therapy is not about them. It always has to remember it has to benefit the client. So and in the earlier post that I put, always like we just need to find our happiness, we not in the material things but in our heavenly Father. So I think I was able to answer the question about how to draw boundaries or how to set ourselves with a healthy relationship with the client. Thank you.